Wednesday, 175 families across the country who had their relatives in hospital who had contracted the coronavirus disease had a reason to smile after their kin returned home, having beaten the virus that has reorganized the world order. The number of recoveries being the biggest win for the health sector in a long time after numerous efforts to fight the pandemic that has left many in other jurisdictions clinging on to dear life.
Today, first, we're delighted to inform you that we have discharged the highest number of patients in a single 24-hour period. We have discharged 175 patients from the various facilities who have recovered from the coronavirus disease. This brings the total number of recoveries to 1,048.
Despite Kenya's total caseload surpassing the 3,000 mark, more than 75% of the patients are said to be asymptomatic, which could be a good sign for the health sector, with new research by the World Health Organization indicating that such patients do not spread the virus. However, some 700 patients are still in critical condition, requiring close monitoring, with a majority of those who have seen progression of the disease being those with an advanced age, as well as those who have pre-existing medical conditions.
Most of those patients who progress to become severe and sometimes even critical tend to be, number one, older patients, two, have some other comorbidities.
We have 781 patients admitted across our public and private health facilities. Out of the 781, 7 are critical. They are in ICU. 4 are under intubation and 2 are under ventilation.
The Ministry of Health continues to register new cases of infection, especially at the country's border points, which continue to be a cause for concern, especially for locals who have to interact with long-distance truck drivers as they await clearance.
And since we launched the protocols that control the movement of truck drivers along the transport corridor, we've seen failures in the system on our part, but largely on the part of the truck owners and the truck drivers.
As the country gears up for home-based care, the question is the government passing this burden of taking care of patients back to its citizens? Jimmy Mbogo, K24, Evening Edition.